Hello everybody, thank you for checking back in. Today we're going to go ahead and go through a lecture that I had prepared for AT Still here in St. Louis. We had talked about briefly in about 40 minutes time about Cerec in a daily dental practice, and so I wanted to dig into that with you a little bit. So let's talk about what Cerec can do, generally speaking. Now, realizing this lecture was tailored specifically for dental students, so they hadn't had a lot of private practice, still going through dental clinics and other lectures and stuff, so this was kind of an eye-opening. Here you go, here's some of the options that we have, here's what it can do for us. So many of these cases that you're seeing on the screen are cases that I have videos out there already discussing. This is just kind of a show-off slide, so to speak, some of the cases that I've been able to complete with the assistance at Cerec. So again, a little bit about me. This is my experience. In '96, I went to Central Missouri State University focusing on jazz. Spent a couple of years in Taiwan speaking Mandarin Chinese. To this day, I still speak some, but a lot of it's left me. I haven't used it a lot. 99, went to Central Missouri State as a business major, transferred to UMKC after I married the daughter of an orthodontist, and focused on dental school. Graduated undergraduate, and then went to dental school 2002, 2006, started my own practice in Liberty, Missouri. Bought another one a year later, joined a small group in 2011, and then left that group after I sold my practice to the group to join a Pacific Dental Services supported practice. So this is my family. Me and my wife, we've been married going on 19 years this year. We have 5 kids. They are everything to me. They are why I do what I do. So I'd ask you to consider for yourself, why do you do what you do? For me, it's my family. It's to provide an income, a living for my family, and to serve people. So that's my story. So Cerec can do amazing things for us. It really can. Provides us with a fantastic, quick opportunity to do bridges, crowns, inlays, onlays, implant restorations. Really speeds things up for us moving forward. Let's take a step backwards real quick. You'll notice all these slides are going backwards. And talk about the basics of what Cerec is. What is Cerec? Here it is. So Cerec, stands for any number of things. I think officially it stands for Chairside Economical Restoration of Aesthetic Ceramic, or maybe Chairside Aesthetic Restoration of Economical Ceramic, or Ceramic Reconstruction. I usually tell my patients that it stands for Ceramic Reconstruction. That makes a little more sense than a big long acronym. So what can it do? What is it? What is the learning curve? Is it a benefit to my patients? Is it a benefit to my practice? And is it cost and time efficient? We're going to dig into each of these questions here as we go through this presentation. What is Cerec? Well, we talked about what it is. It's a machine that allows us to complete all sorts of treatments. Is it a benefit to my patients? Is it a benefit to my practice? And is it cost and time efficient? So is it a benefit to my patients? I think so. We can do a lot with Cerec. Here on the left side, you can see a patient who, believe it or not, did not have any issues with methamphetamines. Heavy smoker, lots of soda. Over-the-road truck driver, nicest guy on the planet, very nice guy. Smoked, and like I said, lots of soda. Over-the-road truck driver. This is a substantial benefit to him. This is, step 1 of 6 or 8 steps. He wanted to fix his smile first. Next step is working on the lower anterior. We're going to do a few crowns and some composites. Needed scaling and root planing, so that was the first step before we did any of this. This patient here in the middle, you can see we did, let's see, was it 15 crowns on him? This is all Cerec. This I use Smile Design for. I'm sure many of you have seen this case, maybe not with his full face, but here it is. Dramatic transformation. He's smiling a little bit wider in this picture, but it was a fantastic opportunity to benefit this patient. And then you can see here on the right side, This patient, we did 6 crowns. These are Vita. This is feldspathic ceramic. This is Emax, lithium disilicate. This is feldspar. And we were able to close his space here and, of course, correct some orthodontic issues, or disguise the orthodontic issues, I guess I should say, with 6 Vita crowns. So yes, it's a benefit to my patients, in my opinion. Solid benefit. Is it a benefit to my practice? Same-day treatment opportunities. It allows us to complete inlays, onlays, bridges, crowns, veneers, you name it. And this is an implant crown in a single appointment, same day, like you can see here. There doesn't necessarily need to be any additional crown seat appointments unless there's an issue with the machine, or you don't have the right shade, or you don't have time to completely design it. In which case, sure, you can always opt for that. We don't need any temporary crowns to re-cement. In my experience, temporary crowns usually end up being more temporary than we hoped. So this is a solid benefit that we don't have to re-cement any temporary crowns. And self-promoting word of mouth. So this is a great referral opportunity for our patients to talk about treatment that we provided. So absolutely, it's a benefit to the practice. Now, considering this unit here, we can save hundreds of dollars. A couple $100 for an implant crown unit like this, as opposed to sending it to the lab. Not only that, but we can do it in a single day. So let's talk about a schedule here. This is my schedule for, what was this date? March 14th, 2019. You can see here was the schedule, some opportunities for treatment, and here's what we ended up doing, some of the treatment we ended up rendering. Excuse me, so you can see 3 treatments here ended up being Cerec, 3 that we're showing. This was a root canal crown on number 18 that I did not happen to highlight a picture in there. And we did have a re-cement. This was actually a redo. But you can see we were able to do a crown on composite. Here we did a crown here. Yes, I did remove all that extra cement. And then we also did a crown here, and then a couple of weeks later we actually went ahead and redid all of our crowns. We did 5 more crowns, and I redid this crown at no cost to her when we redid them, because I wanted to design her smile a little more better. A little more better. Anyway, so yes, several opportunities. I could say that this is a great opportunity for same-day care. Now, could we have done conventional crowns? Absolutely. Absolutely. However, if I'd done same-day crown, not done same-day crowns, and done conventional crowns with a return appointment, then that second appointment would have been, I would have had to use a second appointment, so I could not have used it for another patient, if that makes any sense. So essentially, we're taking a single appointment procedure with a Cerec crown, whereas conventional crowns, we now have 2 appointments that we have to accomplish. So it frees up the schedule for additional treatment. All right, here's another schedule. This was actually the same day I gave the presentation, March 15th. And here's what we ended up doing there. Root canal and a crown. Same day, that's actually that case. Nope, not that case. It's 29 and 30. Sorry, wrong image. But you get the idea. So it was 2 teeth on the lower right. And then here is an Invisalign that we scanned, not at the same time, but this is just to illustrate that we can actually use our Cerec ortho to scan for Invisalign. So again, a solid benefit to the practice to be able to minimize impressions and time, etc., with treatment rendered same day. Okay, again, another appointment, or another schedule, March 19th. So the question mark is, where are the opportunities here? Well, these are all opportunities. Can we impress for a night guard with Cerec? Absolutely. We scan it digitally. No need for goopy impressions. Certainly you can use any number of different scanners. Since we have the Cerec, there's no reason to invest in another one. It'll do just as good. And the new Cerec Prime Scan is really a leaps and bounds better than the OmniCam, so that'll be fantastic when I get my hands on it. New patient here with front teeth that are black. Can we use the Cerec? You bet. Emergency limited new patient exam, crown came off. Yeah, a Cerec opportunity. New patient wants to discuss implants. Will this be a Cerec opportunity in the future? Absolutely. So tons of opportunities to benefit the practice and the patients and the bottom line with using Cerec. So here's probably one of the biggest take-homes. With Cerec, there's no crown seat appointments, no second appointments, unless it needs to be, which means you save that time for another procedure. So saves time. Time savings equals money savings. Just a quick, breakdown of cost. Cost efficiency for me, the biggest time saver is this chair time. When you're looking at a standard crown, essentially you have double the time, but you have the appointments spread apart. So you've got also front office time that you're using. So in the long run, you end up saving money and time, saving money and time by saving time, if that makes sense. So lots of cost efficiency here and time efficiency. So what else can we use Cerec for? Can we scan for full or partial dentures or Invisalign? Yes, absolutely we can. So we all know there's Cerec Ortho out there. You can use Cerec Ortho to scan. I've found Cerec Ortho requires a little learning curve as compared to standard Cerec because of the uniqueness in the scanning protocol. So yes, you can absolutely scan with Cerec Ortho. However, I would suggest personally, just because I'm so much more familiar with scanning with regular Cerec, is that you scan it with Cerec, like through Sirona Connect, and then export it onto your desktop as a DXD, and then import it into Cerec Ortho because you'll scan it a lot faster. And as long as you're creating a good quality scan and taking the appropriate time, it'll be just fine. I personally don't like to scan directly into Cerec Ortho, at least not with the version that we're on now. I like to scan it in Sirona Connect because I find it a little easier based on my decade or more of Cerec training and use. So here's a couple of cases. You'll notice the bottom in the center, this case is a lot older. This one right here, it's much older. The other two on the top are more recent cases. And you can see the top two were scanned with Cerec Ortho. Turned out just fine. You can always do refinements. It's very simple, very straightforward to rescan. But being able to scan with Cerec Ortho or Cerec and then import to Cerec Ortho and send through Sirona Connect is a great boon to the practice. All right, I'm going to let you listen to this video. Prosthetic using a Cerec OmniCam. This is scanning for a removable prosthetic. So we're in the Cerec software now. I'm going to go ahead and move away from the Cerec software. I'm going to go to the Sirona Connect software. This is the software where we will scan for everything aside from restorations we'll complete in the office. Okay, we're going to add a new patient. I'm going to put myself in. So now here is our restorative choice screen. So like for instance, in this particular situation, this patient, we're going to scan for a lower partial denture. So you can see here I've extracted these 5 teeth atraumatically, beautiful extractions, and squirted some polyvinyl siloxane down in there. We're going to go ahead and scan this model, assuming we're going to make a Valplaster, Duraflex, or a Q-cell partial denture. So here's what I'm going to do. I'm just going to leave it on crown. I'm going to select tooth number 1. So here's our scan screen. You'll notice the camera is now active. You can see it flashing there. Anyway, so you'll notice how I hold it. I hold it like a handpiece. The weight balanced. Pretty much in the center. You'll see some new docs, less experienced, that will hold it in this manner. It's just more difficult, kind of like the pen curing lights. It's easier to hold if you have the weight of the instrument on the top of your hand as opposed to underneath. You can rotate a lot easier than you can with your whole wrist going over. So this is my position. So you'll notice here on the screen, it's asking me for the upper jaw. I can certainly select lower jaw first, that's fine. Now you'll also remember, you want to notice that the patient's going to be in the reclined position generally, so roughly in this orientation to me. So remember, you need a fulcrum, So I'm going to grab a fulcrum, and as soon as I get to focal length, it's going to start scanning. So you can see there on the camera that it's out of focus. As soon as I get to focal length, it'll start scanning. So I'm going to start scanning right about there. And you can hear it popping. And we're just going to slowly gather the data that we need. Now, a couple things to bear in mind. Good retraction is really important. And sometimes on these lower anteriors, you'll have a hard time getting those images. So I've still got my fulcrum, it's my pinky finger there as I'm going around. Okay, now let's take a look at these models. That's kind of a rough initial modeling. I'm going to zoom in so we can take a look here on the screen. So you see right here, we're missing all that data. And if we go to the distal of the canine, we're missing some of that too. Now the computer may not necessarily show all of it, but we're missing more data here. We don't necessarily need the back of that unless you're going to have a clasp, so in this case we would. So I'm going to fill in those areas where the data is incomplete and also make sure I have a nice clear lingual down here where the partial is going to wrap, and then we need some of the vestibule. So right here, I'm going to again get my camera into position, and you kind of wait for it to find the common data, and then gently scan. You want to do your best to get those angles. All right, then I can again inspect the imaging. Let's see if we can get any better in there. Now, one thing I started doing at least, is I'll turn the camera so it's going out of the mouth sideways and then angle it down here. So you can actually get a really nice view along the side of the tooth. Let's do the same thing for the distal of that canine. So there I am, I'm leaning it sideways. I'm going to come around, we're going to do the same thing. We've got some extraneous impression material, which we're just going to kind of ignore for our purposes today. And then I do want to make sure I complete this entire second molar, get some real nice data there. Okay, now let's take another look. Looks pretty darn good. Granted, it's a lot easier to do out of the mouth. You can see here's some data here that we need to fill in. So I'm going to hover it over until it starts to recognize the data, and then it'll start popping instead of that dinging noise. Try to change my fulcrum there so it's not in the way. Okay, let's take a look again. See, that to me looks pretty darn good. We've got a clear image of all the teeth that will be involved in the wrap of the clasping. And we're talking about a flexible, a Duraflex, a valoplastic Q-Sil. Let's go ahead and do the upper. You see the computer is still processing these images. Let's do the upper jaw. So again, I'm going to try to replicate the way it would be in a patient's mouth. So I'm going to use my fulcrum. Here's my ring finger fulcrum and kind of my chopstick hold on this, but a very firm hold. This is an $11,000 camera, so don't drop that. Grab some initial contact and then start working your way around. Now, this set of modeling is not nearly as critical as the lower, because this is just going to be used really to gauge the occlusion. So we don't need quite as much detail as we had on the lower arch. But we have to include all the teeth that are going to articulate with that partial denture. So you'll notice how I switched the angulation of the camera. You can feel free to switch it as much as you can. In the blue cam and the red cam, we couldn't do that. You had to keep the camera oriented in the same direction. But remember, there are lips and cheeks here that we have to work around, and tongues, of course. The one thing I didn't do on the lower, we're going to need to punch back in and add to, is we need more of the extensions on the vestibules. Okay, so let's take a look. That'll do just fine for the occlusion. Let's see if I can snap in this picture right here on the canine. There we go. Just fill that in a little bit. Good. All right, buccal scan. Click on buccal, ask the patient to bite down, and I usually ask them to make sure that all of their teeth are touching and squeeze as hard as they can. See, it started to catch my finger there. All right, so if you get an extraneous scan of your finger, just drag it over to the recycle bin, hit yes, and then again, I'm asking the patient to clench as hard as they can, but to make sure both sides are, and the molars are touching together. So usually the way that I say it is, go ahead and bite together, make sure both sides in the back are touching at the same time, like you'd normally clench, and squeeze really tightly. And then I'll start at the anterior, and I'm going to sweep up and down. I'm going to go all the way back and include those posterior stops on the partial. And now, then I've got to rotate the camera. Because remember, we have lips involved here, and cheeks. So again, I'm sweeping up and down. All right, and that basically includes everything that we need to include, gives the computer a really accurate scan. Now, if you're doing a full arch bridge, I'd go even further than this. So on the front, I usually start the scan, and then I tell the patient, go ahead and open. I'm going to scan over and include the occlusal portions. This gives you a lot more accurate data on the bite, and then do the same on the lower. Bite together, start the scan, go ahead and open, and try to follow that lower jaw as they open. Oh, there we go. You want to give the computer a little bit more data so that it'll recognize the articulation a lot better. The occlusion, I should say. Okay, so then we're going to double check that we have everything we need. Normally, that's all that you need. Okay, now, I'm going to turn the camera off. Now you'll notice we have a little bit of weird data right there. So watch that as the computer calculates it. You want to make sure that the computer cleans that up and that it doesn't give you any weird proposals. You see we have a very limited interarch space here, so partial denture, given granted that we did these very atraumatic extractions and didn't do any alveoplasty, there's not a whole lot of space for a partial denture there. Yes, you can get one in there, but the teeth are going to be like 2 millimeters high, given the 3 or 4 millimeters of acrylic, 2 or 3 millimeters. So this is not a good indication for a partial denture. A bridge, even a bridge would be a challenge with that interarch thickness there. So in this situation, if you did want to consider a bridge, it might be worthwhile having some alveoloplasty done. Okay, so next step, we're going to go ahead and hit next. And this is something you can delegate to an expanded function dental assistant in Missouri. Okay. Looks good. We got a lot more data down there. And you can certainly also include all the palate if you needed to for an upper partial. Palate's a lot easier to get than, of course, the lower lingual. All right. So next step, take it straight to Connect, to the Cerec Connect, the actual portal where you're uploading it. So it's going to log me in to your Sirona Connect website through the app. Of course, put in your personal password, the office password, username and password, and then log in, and you get the portal. And it'll show you the actual progress of the upload. As you can see, we're uploading. Must have a really fast upload speed. Okay, so you'll notice it's showing a crown, full contour, see additional notes, and Vita shade, classic A1. There are different choices for the shade guides if you want to use them. We're just going to put this as a male. Glidewell lab. You can add different labs if you want to. The only one we normally send to from this location is Glidewell. And then I can type in lower bowel west partial wax try-in shade A1 call with questions. If you want to, I've already communicated with the lab. They know my preferences, the abutment clasps and stuff, so they'll send me back a wax try-in at that point. On the slip that they send back, I can write, here's where I want my clasps and stuff. Of course, with a wax try-in on a Valplast, there will be no clasping. And then you can select the return date. Just because I say tomorrow doesn't mean it's coming back tomorrow. You need to communicate with the lab and know what their delivery dates, time frames are. Normally, today's Monday. On a try-in, they'll upload the case today, they'll print and manufacture the modeling, then it'll take a couple of days to set up and then a day to return. So I'd say a week is reasonable for a try-in like this, but for some people, in some situations, it takes longer. So then I'm going to add that to the cart. I have not submitted it yet. This has not yet been submitted, so the lab's not working on it. Once I hit submit, though, it'll ask me for my password again, and then you can pull up, I'm not going to click because of HIPAA, but you can pull up the previously commissioned orders, the ones that have been accepted, any orders that were declined, and any other issues. So pretty simple stuff. The process really is not that difficult. It really works well. So that's the Cerec Connect. That's scanning for a partial denture. Lots of data there. Sorry, that was kind of a cumbersome video, but that gives you an idea that you can actually scan for a partial denture or even a full denture, depending on your vestibules and how good your scanning is. At least for a wax try-in, then you probably want to do a wash try-in on a full denture, or a wash impression, I'm sorry. So, in review, Cerec can be a substantial boon to your practice, a great benefit. There is a learning curve. A lot of it comes down to how much time you're willing to invest, what the status of that, the difficulty that you're looking at, and what the difficulty, how much experience you've had in the past with this type of technology. If you've used some, Adobe Photoshop and you're comfortable with any type of a CAD program or done any 3D anything, honestly, Cerec is really not that difficult. I believe firmly that anybody with some basic rudimentary computer skills, what is the mouse, how do you turn it on, right click, left click, scroll, using two hands on the computer, anybody can learn it. It may take some time, and depending on your ability to work through those challenges and the learning curve itself, it may take others more time than some of us. But it's a substantial benefit to your patients in a lot of situations. I don't think it's the answer to everything, but it's a substantial benefit to your patients and therefore your practice. And yes, it is cost and time efficient once you've given it the appropriate place in your practice and have the necessary skills. So that's all I've got for you. This is me. Right now I'm currently working at O'Fallon Modern Dentistry and Lindenwood Dentistry. That's my cell phone number, my email address, and of course my YouTube page. Anyway, please don't hesitate to give me an email, send me a text, an appropriate text if you have questions, and thanks for watching.